side is important because if they have an acute attack, an exacerbation, and when someone with MS has an exacerbation, that means they have an attack of the myelin sheath, an inflammation going on in the central nervous system. They tend to be a lot weak. Their weakness increases. A lot of them can't walk during an exacerbation. Trouble swallowing. Certainly I'm concerned about their respiratory status. I may have to suction. But we need to, treatment of choice is IV steroids. We give IV steroids for that inflammatory process that's going on. We're going to follow it, taper it with prednisone. And again, when prednisone, tends to be stimulant, so they may not sleep, increased blood pressure, blood sugar may be out of control, mood swings, retained fluid, all the signs and symptoms you'd see, the side effects from steroids. The other thing that they may try when they're in an exacerbation is plasmapheresis. So plasmapheresis is basically like dialysis. It's going to pull off a unit, it's going to wash the blood. So it may pull off a unit, spin it down, take the plasma, which has the white blood cells. We're going to get rid of that, and they're going to return the red blood cells. And the goal is that as they take away the white blood cells, your body's going to have to make more white blood cells. And hopefully the new white blood cells will not attack the myelin sheath. So I've had patients 24, 25, 26 plasmapheresis treatment. We barely saw any change. Other times we've seen some changes. But again, it's a way for them to try to see if that would work. So that's going to treat the acute exacerbation.
So what exactly, because I know prednisone is more like anti-inflammatory. So what exactly is that doing for the body? What exactly are they having attack?
So they have an inflammatory process going on in the central nervous system because the antibodies are attacking the myelin sheath. It's that whole inflammatory process is causing an exacerbation of symptoms. So we've got to hit that inflammatory process. So, and then once the acute phase is done, we want to try and increase that remitting period, and that's what these disease-modifying treatments called immunomodular medications. These are the three most common. There are other medications out there, but basically, I just want you to know there are disease-modifying medication. Which one they would have? Well, I know the interferon beta 1b beta seron, that's sub-Q daily. So you may have a patient saying, all right, that's not bad. Avonex, the interferon beta 1a is IM once a week. Well, I've had patients turn around and says, no way am I giving myself an IM injection, so you better find me a medication that I do not have to give an IM to myself. Where I've had other patients that say, I'm not giving myself any injections, so I'd rather drive to the clinic once a week as opposed to going daily. So sometimes it's which one they put them on, a lot of how the patients will be able to manage their medication, or if they react to one, they may try another. So basically that's how it would work. But with a lot of these interferon, the disease-modifying medications, I'd say the biggest side effects of flu-like symptoms is the biggest thing. But we can also try, like chemotherapeutic agents, immunosuppressant meds, because again, it's an autoimmune disorder like cancer, so we may be able to try some of the chemotherapeutic meds to see if it works. But again, the whole goal is to prevent an exacerbation and increase that remitting period. Then we got to treat symptoms. So with multiple sclerosis, spasticity is a real symptom. Drug of choice, baclofen. Yes, you would need to know that for the test. For bedtime, they may have they may have increased spasticity, so they may take diazepam at nighttime. but we're gonna just treat symptom by symptom. If they have pain, depending what the pain is, if it's just bone pain, we may try an NSAID, but if it's nerve pain, the NSAID's not gonna work. We need to use an anticonvulsive med like gabapentin to help. Bladder dysfunction, if they have an overactive bladder that's leaking, we may try some medication versus a bladder that's retaining and having stagnant urine cause an infection. So, we've got to treat whatever symptom they're having. If they're retaining urine, yes, we're going to get to self-catheterization or Foley. Typically constipated, so our stool softener laxatives are going to work. And with most neuromusculars, again, emotionally, they're not the same. They're their body's going through so many different things. So there could be depression, may need some antidepressant medication, a lot of support. Any more serious psychotic disorder, paranoia, manic, we may need to get something heavier. But fatigue is real. Fatigue, we may have to give medication, amantadine, something to help increase their energy. But basically we'll tell them energy conservation, the 4 Ps. Planning, so if I live in a 2-story house and I need to run upstairs for something, I want to think through, is there anything I need for the rest of the day upstairs so I don't have to go up those stairs again? Prioritizing, so the beds aren't made today. Positioning, if they're doing laundry, use a utility cart because it's a lot less energy to push a utility cart than to hold laundry. Or to use a speakerphone versus holding a cell phone, because believe it takes a lot of energy just to keep your arm up if you're talking. So really going over a lot of energy conservation and just pacing, balancing rest with activity. So those are the just energy conservation. Spasticity, again, baclofen is going to be my drug of choice for spasticity, but things that cause spasticity: cold temperature, high humidity, tight clothing, tight shoes, constipation, poor posture, any type of infection, a UTI. So anyone who has spasticity, we may need to use braces, splints, but then I'd have to treat whatever or take care of whatever is triggering the spasticity. Already talked about urine retention, urine frequency. Again, my central nervous system controls my urinary system. So whether I have overactive bowel versus retention, I'll have to treat it. Those are the 4 Ps for energy conservation. All right, this slide you will not need to really know, but basically MS is considered a crippler, not a killer. These are all my primary symptoms as a result of multiple sclerosis. So I have weakness, fatigue, bowel and bladder dysfunction, causing me to fall, have UTIs, and change in sexual function, leading to I lost my job because of the falls and the UTIs, social isolation, and I got divorced. So again, those primary symptoms lead to secondary symptoms, lead to tertiary symptoms. So they do tend to have a lot of issues going on. My prognosis, known as a crippler, not a killer. And the other thing that you would not really need to know, because I would never remember this, but one of the things for nursing, you diagnose somebody with multiple sclerosis, they want to know, so what's my course? There's 4 different courses. What is my course going to be? So basically, we don't know, except we do have enough research out there to be able to predict. If I have a female in their 20s that start with sensory, tingling, numbness, and that she's had some symptoms and it only lasted a little couple days and it's gone, that basically she's probably on a relatively good course, relapsing remitting. Where if I have a male, 50 years of age, having trouble walking, maybe fell down, symptoms lasted quite a while, left for a day and then they came back, probably relatively poor and probably onto a progressive course. So sometimes we can tell just by looking at, their age, whether motor, sensory, male, female, what type of course that they're on. And then discharge planning, education, follow-up. They're going to be followed up and connected to the MS Society. One of the things that I had mentioned for the acute phase for MS was IV steroids. One of the other things that is very popular with multiple sclerosis is bee venom therapy, where they actually will learn to manage bees, take forceps, pick up the bees, and sting themselves strategically in different places, where I've had some patients say, I take 4 bee stings every 5 days for good effect. And the bee venom therapy is almost a little bit like steroids. After they get stung, they feel stronger for several days after. But they have to know how to manage them. And so there'll be a huge population of people with MS that want nothing to do with having bees in their home. But again, as nurses through your history, you'd have to know there's a lot of complementary therapy that you need to find out. So they have disease-modifying medication, but what else are they taking out there? Okay, a couple questions for MS. Which of the following nursing interventions would be the best to use with a client who's experiencing a 3rd relapse of multiple sclerosis? A, provide client with a hot bath daily. B, plan care activities for morning hours. C, set a plan of care for activities and ask each nurse to follow it. D, put client extremities through range of motion each shift. B, who just said B? Somebody just said B. B is correct. So first of all, hot bath is going to increase fatigue, it's going to increase spasticity. We're not going to do that. We know 3rd relapse, weakness, fatigue. So they're going to be their strongest in the morning. So we want to try and do activities. To set a plan of care and everyone follow the activities is only going to contribute to weakness and fatigue. We want to minimize, do what we can when they're at their strongest, but minimize it. And then put clients' extremity through range of motion exercise each shift. Yes, we want to do it, but that's really less of a concern than trying to manage the fatigue and the weakness right now. So B is correct. Okay, the next one. Which of the following statements made by a patient diagnosed with multiple sclerosis would alert the healthcare provider that the patient requires additional instruction about the disease? Select all that apply. So basically, it's going to be the ones that you're concerned of that need extra teaching. So use of stress reduction strategies can decrease the severity of my symptoms. Anything wrong with that? Would you? No, that's fine, absolutely. We want to keep stress down. I will avoid foods that are high in fiber to prevent problems with my bowel. False. I want to do more teaching. They're constipated. We need high fiber. It's important for me to inspect my skin daily to make sure there aren't any injuries. True. No, I don't need to do further teaching. Absolutely. A hot bath in the evening will help relax my muscles and relieve pain. False. It's going to increase fatigue, it's going to increase spasticity, and put them at risk for falls, any safety issues. So note that one. So B and D are the correct answers there. Okay, so that